Oh, those are my two daughters.
And they're all like competition skiers?
Yes, they are. That's kind of our life.
I am recently retired from Aurora Health Care. I'm an RN by training. In 2010, I received the diagnosis of breast cancer. I will never forget, I broke down in tears with what's going to happen to me. I'm too young to die.
In a patient with breast cancer, the first place that breast cancer would metastasize to, the lymph nodes here in her armpit. So when I met Sarah, she was diagnosed with breast cancer that had already metastasized to her lymph nodes, stage 2 breast cancer. The standard of care at the time was that she would automatically have all of her lymph nodes removed from underneath her armpit. Bye. And as a result, the arm can swell. It's not life-threatening, but definitely quality of life altering. Knowing that she was a water skier, that's not something that I really wanted to have her live with for the rest of her life. But unfortunately, that was the standard of care at the time. We didn't want to leave any disease behind. I asked Sarah if she would be interested in participating in a clinical trial.
I think my first thought was, of course I need to consider this. But then suddenly, wow, it's really easy to ask somebody else to do this, but what about me?
So on any given day, we're conducting about 500 research projects. Over 300 of those are clinical trials. One of the most challenging things with oncology is that tumors are so different. Everything that we do here is to try to understand it better so that we can manage it more in the future. To make the decision to participate in a clinical trial is a very selfless decision, but it's going to have that long-term impact.
Now we don't remove the rest of the lymph nodes so that she doesn't have to face that higher chance. Once the study was released, it gave us surgeons confidence. If the first lymph node was negative after chemotherapy, we would no longer have to remove all the lymph nodes underneath our arm. So I believe that most of us changed our practice over a few months, and then the whole country maybe within the year to follow.
Each one of these trials just chips away at a small part of the cancer diagnosis and the treatment for it. I don't do it for me, but I would do it for my kids. I would do it for the betterment of the next generations.
Hi there. So you must be Aggie.
Meeting Sarah today was a great experience because her participating in an earlier study helped my cancer treatments. Without the studies, we wouldn't have the advance. I am emotional.
We are a community.
We are. Definitely the survivor community. My mom was diagnosed with breast cancer when she was about 49 years old. Mom's treatment of cancer played a big part in why I wanted to be in this study. My goal is that the research that they find out from my study will in turn pay it forward and help someone.
When patients come back to you year after year from having cancer to no cancer, it's a good feeling. You treat every patient like family because it's inevitable. A lot of them start treating you like family too.
Relations like this and relations like this. That really.
It's all about giving forward, helping somebody else understand that we together can fight so somebody else doesn't have to be diagnosed with this.